Hi, I'm Jenny Morrison, and this is my informative speech. I'll try it once or twice. I can always stop. Many people think this, but those who start down that road find it nearly impossible to turn back. Sam, a 15-year-old boy, was quoted saying, "When you first shoot up, you will most likely puke and feel repelled, but soon you'll try it again. It will cling to you like an obsessed lover. The rush of the hit and the way you'll want more, as if you were being deprived of air. That's how it will trap you." Sam is a 15-year-old heroin addict. Heroin is a highly addictive drug that has serious side effects and is an epidemic in our tri-state right now. I do not know the capabilities of the drug firsthand because I do not use the drug, but I have seen the side effects on patients in the hospital when I was in nursing school and also on my own friends. I've sat in the hospital for hours waiting for a friend to recover from an overdose on the horrible drug. Let's jump into the facts of what heroin is and what it really is capable of doing. So everyone might ask, what is heroin? Heroin is a highly addictive drug derived from morphine. It's obtained from the opium poppy. It's not a stimulant, but a depressant in which it affects the brain's pleasure systems and interferes with the brain's ability to perceive pain. It's a Schedule I drug in its classification. So what does it look like? It appears as a white to dark brown or even a black powder or even a tar-like substance. In its purest form, it's a white powder. More often, though, it's gray, brown, or black from the additives used to dilute it, which may be even sugar, caffeine, or any other substance, including poisons. So how is it used? It can be injected, smoked, or snorted. Usually it's injected into a vein or even a muscle, and it can be smoked in a standard pipe or a water pipe, or it can even be mixed in a marijuana joint or a cigarette. It's inhaled through a straw, that's known as chasing the dragon, or it can be snorted as a powder through the nose. So the origin of heroin, it was first manufactured in 1898 by Bayer Pharmaceutical Company of Germany. It was marketed as a treatment for tuberculosis and a remedy for morphine addiction. During the 1850s, opium addiction was a major problem in the U.S. A solution to this problem, they created morphine. Morphine then soon became an addiction itself and became even a bigger problem than opium. The solution to the morphine addiction was then heroin, which became even more addictive. The solution to a heroin addiction was methadone. By the late 1990s, mortality rate of heroin addicts was estimated to be as high as 20 times greater than the rest of the population. Today's street names include, but are not limited to, Big H, Black Tar, Horse, Muck, Smack, Junk, and Hell Dust. Heroin has so many different side effects to it, from the street drug being laced with so many additives to just the regular form of it. Some short-term effects, which appear soon after the single dose and disappear within a few hours, is first an initial feel of a surge or of a euphoria or a rush. It's accompanied by warm flushing of the skin, a dry mouth, heavy extremities. After the first initial feel of the surge, you're going to go on to what is called on the nod. On the nod is a wakeful and drowsy state. Mental functioning becomes clouded due to the depression of the central nervous system. It's also accompanied by slow and slurred speech, slow gait, constricted pupils, droopy eyelids, impaired night vision, vomiting, and constipation. The long-term effects, which appear after repeated uses for some period of time, include collapsed veins, infection of the heart valves, abscesses, cellulitis, liver disease, pulmonary complications including pneumonia, and the additives that do not really dissolve in the bloodstream, and they result in clogging of blood vessels. This will in turn cause permanent damage to vital organs. Soon after chronic use and after time, your body will develop a tolerance. This tolerance means that you need more of the heroin drug to achieve the same intensity or effect that you were getting just last week. As higher doses are used over time, the physical dependence and addiction develops. The body has adapted to the presence of the drug, and withdrawal symptoms will occur with absence or even reduced amounts. These peak around 48 to 72 hours after the last dose and last about a week. These withdrawal symptoms include drug craving, restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes with goosebumps, kicking movements. But other health effects also include fatal overdoses, spontaneous abortion, infectious disease, including HIV and hepatitis because of dirty needles being used when it's injected. Treatment for this addiction includes behavioral therapies, such as like going to groups, having social support is one of the best things to have. It's also medication is a treatment. Buprenorphine and methadone help a person wean off and reduce the crave of the addiction, while naltrexone actually prevents the drug from having effects. Naloxone is also used as an emergency treatment to counteract the effects of a heroin overdose. In closing, heroin is a very addicting drug that affects so many around us. It can be used in various ways, including inhaling, smoking, snorting, and injecting. It originated many years ago as a solution to other addictions, but it became even a bigger problem. The side effects are serious and life-threatening, yet the addiction is at large and now an epidemic in our tri-state. I leave you with this quote from a woman named Sabrina who has experienced this life. Your whole day is spent finding or taking drugs. You get high all afternoon. At night, you put yourself to sleep with heroin, and you live only for that. You're in a prison. You beat your head against a wall nonstop, but you don't get anywhere. In the end, your prison becomes a tomb. Thank you.